Black fungus cases are on the rise in patients suffering from COVID-19. States are recording a big rise in cases of black fungus. Maharashtra has sent an SOS to the centre, while Rajasthan has declared this an epidemic. It is a rare but serious fungal infection. Here's more.
The second wave has brought with it an even more dangerous side to coronavirus. There's another infection that's on the prowl across the country, one that is even more deadly and spreading fast. Black fungus infection is rising dangerously among COVID patients. On Wednesday, the Maharashtra government confirmed 90 deaths due to black fungus. It said there were at least 1,500 more cases in hospitals.
एम्फोटेरेसिन बी ये इंजेक्शंस पूरा परचेज करके महात्मा ज्योतिराव फुले जन आरोग्य योजना के हॉस्पिटल्स को दिया जाएगा और गवर्नमेंट हॉस्पिटल्स को भी दिया जाएगा। तो इसीलिए म्यूकरमाइकोसिस के मरीजों पे उनके जेब से खर्चा न हो, यही व्यवस्था हमने प्रॉपरली की है।
In Delhi, more than 80 cases have been confirmed by hospitals so far.
Two parallels. One is COVID positive mucormycosis and COVID negative mucormycosis, and they are being accommodated. And I must tell you that every single day in the emergency, they are, it's like an average 20 and above, and they're multiplying.
In Lucknow, there were more than 50 cases in a single hospital. In Uttarakhand, over 40 cases. Rajasthan has declared the black fungus to be an epidemic in the state. The Union Health Ministry is now on an overdrive to spread awareness about black fungus.
ऑनरेबल प्राइम मिनिस्टर ने देश के उन डॉक्टरों से जो कि इंटीरियर एरियाज में, रूरल एरियाज में और 2 टियर और 3 टियर टाउन्स में काम कर रहे हैं, बोथ कोविड और नॉन कोविड सर्विसेज प्रोवाइड कर रहे हैं, उनसे भी इंटरेक्शन किया। उनसे रिक्वेस्ट भी की है कि म्यूकरमाइकोसिस जो कि एक नई समस्या के रूप में उभर कर आ रहा है, उसके बारे में अवेयरनेस स्प्रेड करें, पर्टिकुलरली 2 टियर एंड 3 टियर टाउन्स में भी।
Health experts have said that the fungus develops as a consequence of steroids that reduce immunity and increases the blood sugar levels in critical coronavirus cases. It hits chronic diabetics the most. With Milan Sharma, Bureau Report, India Today.
Well, this is a concern in several states in India right now. Let's take a look at where black fungus or mucormycosis is spreading. Black fungus spreads in Maharashtra, over 1,500 confirmed cases. When we say confirmed cases, remember there are many cases of black fungus with not too many symptoms and they actually go undetected. So that's something we can't forget. Delhi reporting over 80 confirmed cases of black fungus. We have cases in Lucknow city, over 50 confirmed cases. In Uttarakhand, over 50 confirmed cases of black fungus. We have the spread in Rajasthan as well that has declared black fungus as an epidemic, and Telangana too declaring this as an epidemic. ASSAM this morning has reported the first death due to black fungus. Kumar Kunal is getting us more details on that. The Delhi government is obviously concerned. Cases are being seen in Delhi, if not too many, but there is a worry. Kumar, tell us what the Delhi government is now planning.
There is obviously a concern around the black fungus disease, especially the kind of spread it is witnessing in last few days across the states. That's why Delhi government has convened a meeting, a high-level meeting just now, which has ended a few minutes ago. All the senior ministers along with Chief Minister Arvind Kejriwal participated in that meeting. There are a few concerns, like the number of cases are rising. That is one of the concerns. The second concern is amphotericin B, which is the antifungal medicine and out of stock at most of the chemist shops, and even hospitals are unable to provide that medicine. So that is also a cause of concern. Although yesterday Delhi government has constituted a committee of 4 members who all will look into the black fungus disease matter, but still there are certain things which are needed to be clarified, and hence in that context today's meeting is quite important. And all the senior officials, all the ministers who participated in this meeting might chalk out a few strategy regarding dealing with this disease. So a statement is likely later today from the Delhi government that what all they are doing to control this black fungus disease as of now.
All right, Kumar, getting us all of those details. Thanks for the moment. Well, after COVID-19, another rare infection is spreading its roots in India. At least 40 cases of black fungus have been reported from Surat also. Health experts are saying that COVID patients with weak immunity are more prone to this deadly infection. Let's find out what is this infection and who is most vulnerable. It is called the black fungus, and this infection is back. Delhi's Sir Gangaram Hospital, which has seen cases of mucormycosis earlier, is also reporting a surge in this fungal infection once again. Last year, this deadly infection caused a high mortality, with many patients suffering from loss of eyesight, removal of the nose and jawbone. This infection is seen in patients who have recovered from COVID-19.
Major signs and symptoms of this mucormycosis kind of a fungal infection is the swelling around the face, mainly in the paranasal region. Along with that, orbital swelling, eye swelling, discharge from the nose. These kind of features we are seeing in the post-COVID patients.
Many COVID patients have diabetes as comorbidity, and this could be one of the reasons for this rise in black fungus infection once again. COVID patients with weak immunity are more prone to this deadly infection. Doctors say the infection is worse this time around.
पिछले साल हम लोगों ने कोविड की महामारी के बाद बहुत सारे केसेस ब्लैक फंगस या म्यूकोरमाइकोसिस के देखे थे। इस साल इस बीमारी का और बुरे तरीके से हम लोगों पर आना बहुत एक संभावना है, और इसका इलाज एम्फोट्रिसिन यानी कि एंटी फंगल दवाई से अस्पताल में और बाद में कुछ सर्जरीज से भी जरूरी है, अदरवाइज ये जानलेवा बीमारी है।
At least 40 cases of black fungus have been reported from Surat and Gujarat among those who have recovered from COVID-19. Of the 40, 8 have lost their eyesight. The number of such cases has increased as Gujarat sees an exponential rise in coronavirus infections. The infection triggered by COVID-19 is treatable, but if left untreated or if the treatment is delayed, the condition can lead to the loss of vision and in some cases, increased mortality. The general symptoms include one-sided facial swelling, headache, nasal or sinus congestion, black lesions on nasal bridge or upper inside of mouth that quickly become more severe. Symptoms of pulmonary mucormycosis includes fever, cough, chest pain and shortness of breath. Gastrointestinal mucormycosis includes abdominal pain, nausea, vomiting and gastrointestinal bleeding. The US Center for Disease Control or CDC says that black fungus is rare, but it's serious. Doctors say use of steroids in the treatment of COVID-19, coupled with the fact that many coronavirus patients have diabetes, could be one of the reasons for the rise in the number of black fungus cases once again. With Sanjay Rathod in Surat and Milind Sharma, Sneha Murdani in Delhi for India Today.